don't have to wait for this individual because they are aware that this is happening. So if we quickly just pray, as Africans, let's just pray because this is more like a formal session for us. It's a very unique thing to have Africans go through this process as we are discussing before you join. So if we can pray, that's good. Father Lord, we thank you for this moment. We ask you, God, for useful deliberations. So God, give us the wisdom and time, oh God, to discuss things that that will help everyone and the peers, oh God, in their exams going forward. Thank you, God, for those who have made time to be here. Bless us as we discuss, oh God. In Jesus' name we pray. Amen.
Amen.
Yeah, so Prof, I think the session is just for you, and maybe Edgar has gone through that pathway a little bit part towards getting the diploma. That's why I invited him because I think he's a little bit further in the process, if not for his PhD. He just mentioned to us now to kind of share your experience with the candidates, and then we can listen to see if there are questions that the candidates have, how they feel, what they want to hear from you guys that you can sort of advise them. The aim is really to see whether we can be successful at doing this, and when they come out the other end, some of this feedback that you guys give may be useful for them to prepare or be ready for the question they'll be expecting, or maybe just boost their confidence a little bit more than it is now. I know B has been successful at helping the fellows get to where they are now. It's time for other people to help him to get to where he wants to be. We all have that ladder and we have mentors at different stages. So I really trust in both of you to so I have some kind of mentorship role for these other ones who are trying to get to that stage where Professor Chibu is and where Edgar is also heading to. I guess it will be beneficial to Edgar himself,
Yes.
getting towards that end for next year. There'll be things that you will say today that he kind of may pick on that will help him, okay, in that journey for completing his own section next year. So I'll let you start, Professor Chibu. Just quickly introduce yourself and kind of share your experience. What does it feel like, going through this pathway? You remember your days when you were trying to be a diplomat, how was that feeling for you? And what would you advise someone to do in terms of preparing for this process, towards the end of this journey?
Thank you for having me, and thank you very much. I think for candidates going through the diplomat process, it's not about getting to the end and getting the diplomat. It's about going through the process. And going through the process, you're going to learn a lot from your peers and from those who have actually been there before. For me, I started off in '07 with the old disease section before it was actually sunsetted, and I moved over quickly to the primary care section, which is now called the comprehensive eye care section. And during my time, you have to do like submit like 10 case reports, and 3 from clinical optometry, a minimum of 3 from ocular disease, and a minimum of 3 from systemic diseases that actually have eye, signs and symptoms or clinical, features. And for each case report, you have to do your best to write something that's actually, which actually showcase that you have a great clinical thought process. Number one. Number two, we know that common sense is not common. So they're looking for, does this individual have a great common sense approach strategy to actually solving clinical problems? Also, your writing skills will be also assessed as well. That's need to know that for sure. And for me, for the written exam, we had about 220 questions to be answered in 3 hours, including calculations from contact lenses, neuro-ophthalmic diseases, low vision, cataract and refractive surgery, optics, optics, I remember that one, intersegment diseases, post-seg diseases, pharmacology, systemic diseases, and the rest of them. And then after which you do a 1 hour, short answer questions. You have about 15 cases presented to you, and you have to provide a diagnosis and a plan of management and also follow up for each case within an hour. And then for the practical exam, we had about 5 live patients. One was for BV. For the BV one, I had to do a refraction from start to finish and do the BV testing, provide a diagnosis, and also a plan of management. I had a case of a contact lens fitting, one for intersegment disease, one in low vision patient. That was kind of nerve-wracking. And I had a case of a post-seg. So put it this way, you have a license to practice optometry in your home country. You've been seeing patients for the last 5 or 10 or 15 years. You have developed some sort of, clinical confidence. So I would say to you, never you be afraid to see a patient in front of your peers. If you know you're doing the right thing for your patients, you're thinking of your patients' visual needs or medical needs, and you're doing the right thing, and you're confident that you're doing the right thing, you shouldn't show any sort of lack of confidence when you see someone who's actually your peer. At the end of the day, we have all gone through the optometry degree program. We see patients, we advise our patients, tell them what to do and what not to do. Like for the case of Obi-Wan is doing some contact lens, he has contact lens patients. So whatever you tell your patients, I believe is actually based on evidence-based guidelines. If you use that every day in your practice, you should not be afraid to say the same thing to your patient in an examination setting, because that's what you do every single day. So the essence of doing a practical exam is not actually to test your skills. No, it's actually to observe you, talk to your patient, observe you, how you interact with your patient, and also get to know your clinical thought process. So it's not about can you do, a contact lens fitting. No, it's about how does this individual interact with a patient? Is a patient safe? Is it able to provide, great, clinical management for this patient, utilizing preferred, management guidelines? And that's important. So I would say to you, the aspect of the practical exam may actually, throw some people off, but I will say one thing. If you're doing the right thing in your clinical practice and you're convinced that you're doing the right thing, when you go to the examination in the US, do what you do in your practice, you'll be fine. Don't be afraid. I see patients every day in TI at Solution University. I went to the practical exam. I do make jokes with my patients, make them relax, entertain them. Then when I went to this exam, I was myself. So I would say to you, be yourself. If you're doing the right thing, be yourself. Show confidence. Don't be afraid. You should be fine. And then for the oral exam, they're gonna actually be assessing your, how do you practice your clinical thought process, how you write your papers, a little bit less, but more about what's this guy's clinical thought process. That's what it's all about. When you're doing the practical exam, they're trying to observe you, how you interact with the patient. When you're actually in the oral exam, they're trying to figure out what is this guy's clinical thought process. Is he able to utilize common sense approach to solve clinical problems? That's what they're trying to assess here. And first of all, for the first 5 minutes, they may ask you to say, "Oh, tell us about yourself. Tell us about your scope of practice in your state or your home country, Nigeria. Tell us about your practice. Tell us about your your patient demographics. Tell us about how you get your contact lenses, which are gonna stuff. Going to know about how you practice. Trying to get to know in the first 5 minutes before they start hitting questions. And one mistake we all do is that whatever you put on your case report is actually a fair game for question. If you put anything in your case report, just know that it's going to be a fair game for questioning, and you can't say, "Oh, I didn't know that." For instance, if you put in your case report that I prescribed a patient, sodium cromolyn, which is a master stabilizer, you need to know how that drug works. You need to know, its efficacy. You need to know, would that be appropriate to give a patient? Like if you have a case of a 80-year-old patient who's in school and you prescribe them sodium cromolyn to use 4 times a day, they're going to want to ask you, who's going to put the drops at 12 noon and 3 p.m. when they're still in school? So that's what's going to assess your common sense approach to doing things. Do you know that you can actually prescribe an alternative that will be used only twice a day, which could be administered by the patient's parent at home and at the end of the day? So these are things they're going to be assessing you on. Why did you do this? Why did you use this approach? So these things they're going to be looking at. I have a few questions to ask you about your case report that maybe potential questions that they might ask you, but I'm going to actually yield back to the chair and have Dr. Kure come in and provide his own perspective.
Yeah, thanks, Prof. That's really great and very deep insight there. For me too, I feel this is another way of thinking about the diplomate. I didn't consider that before, but I'm seeing the expert knowledge that this really requires and how it enriches our thinking and thought process, like you said. It does solidify what you already know and do. So I will ask Dr. Kure now to quickly I mean, you've been preparing for this possibly longer than Obi-Wan is, and being practicing in the United States, knowing what's obtainable there, how would you best advise someone going through this and feeling this anxious, about the exam? What would be your best advice for Obi-Wan?
Thank you. It's always a tough act to go after a prof. So he nailed it. Most of the key things I think he already said there, but there are certain things we're informally discussing before Prof came in, and I said that an examiner wants to know you are a domain expert, and they want to assess your knowledge. And what form of knowledge do they expect you to have? Like Prof said, it's going to be evidence-based knowledge. It's not hyper esoteric thing. They just want you to know what the state of care is for every particular case. What is the best evidence? Those things should be known by you. And you should have done a thorough review of the literature in your domain, especially in all the cases you're going to present. You should have done a good literature review. You should have looked at the strongest studies, the strongest evidence, because that's what you're going to use to defend yourself. So if they ask a particular question, why did you do this instead of this? You have a response. If perchance you were not able to do apply the evidence-based method, you should have a good rationale for doing something else. Let me try to put some flesh into it. For example, in your case, I'm going to ask you some questions. In your case, you chose tropicamide and for cycloplegia. And tropicamide, in my own opinion, tend to have low-acting cycloplegic effect. So if I'm in the panel, why tropicamide?
Absolutely, you're right.
Yeah, why tropicamide? Why not cyclopentolate? It's short-acting, and it has more complete cycloplegic effect. Tropicamide, you can use this for older children, with less tone, less predisposed to spasm of accommodation, or just a little bit more less effective, you should have a good rationale for those type of things. The standard of care for cycloplegic refraction is cyclopentolate, okay? But don't panic, okay? Your response could just be as simple as, that's what is available in where I am.
Yep.
Okay. And that will sort of cover you. You can reiterate the fact that, yes, that's the standard of care. That's the main thing. But this is what we have. Then you might want to say, okay, instead of just putting one drop, 1% tropicamide, I did it twice, 15 minutes apart to elongate the efficacy of the drop. Just to cover any deficiency, you understand? It may not be a strong point to knock you off. I don't think it will be, but at least you should demonstrate. You should have at least a rationale for choosing what you're choosing. There was a case of someone going through the process, the same process, and her patient was an 8-year-old patient with blepharitis. And my doc prescribed tetracycline, okay, oral tetracycline, which could be used for blepharitis. Doxycycline is better, but tetracycline is just contraindicated for kids, right? And you should not use it. Kids and women of childbearing age should not be prescribed tetracycline oral. Or stuff like that. And those things come when you are grounded in evidence-based clinical practice. Every aspect of your case presentation does not have to be complex. And I think that's the mistake a lot of people make. The cases don't have to be complex, but the cases have to be backed by good rationale, good clinical judgment. I think that's what Prof was saying. Okay, so that's key. Confidence, he has already talked about it. You can't succeed without confidence. You just have to learn to talk confidently, to talk clearly, to communicate. Block out every other thing happening if you can. Look at the patient in front of you during those practicals and interact with them just the way you're going to interact with your normal patient in clinic. During the orals, look your examiner in the eye, okay? That shows a lot of confidence. If you have shifty eyes around here, around this domain, people tend to read you as not being confident, not knowing what you're doing, not being sure of yourself. Engage. Your focus has to be on the person you're talking with. It's a learning process. You could get things wrong. Be willing to take advice. If they ask you, if they correct you, you take it, say, okay, yeah, you bear that in mind. And that's going to inform your judgment going forward. Stuff like that. I don't think they will expect you to know 100% of the field. Nobody does. Your examiner does not. Okay. So, but there are certain basic things that they want you to know cold, dead cold. And those are the things you should concentrate on.
Yeah, thanks, Edgar. And I think Professor Chibu wanted to chip in something. Prof, I saw you unmute your mic. Were you gonna add anything to that?
Oh, no. I strongly believe that Dr. Kure has covered a lot of ground on what he's saying, and I want to say it over and over again, is that you should not think about the examiner doing your practicals, think about the patient. That's what you need to do. Show confidence, show confidence, show confidence. As long as you're doing the right thing, you shouldn't be afraid.
Yeah, thanks, Prof. I guess we would pass this to Sobi just before we come back to those questions that Prof has. Sobi, how do you feel about this today? What's your state today that you want to express to us? Now, this is a very close-knit group, and we all want you to succeed. The reason individuals here make time to be here, apart from yesterday's session, is to make sure that this is really tailored to people like you. We know the difficulty associated with practicing in Nigeria, but you still have been excelling in all those spaces, which is really testament to how critical you analyze things, how in-depth your knowledge is. So what is it like for you today? How do you feel?
Okay. Thank you guys for doing this and helping out. Um, I'm okay. I don't really get nervous about stuff like this, but the only part that worries me is the practical exam, as I was saying before. I mean, um, I'd gone through, so the process for me was I submitted three research papers, one on scleral lenses and its impact on intraocular pressure and anterior chamber depth. That was published in OVS. The other one looked at corneal edema in the central and mid-peripheral cornea with scleral lenses. And the other one was a case report, I think, on but so the published case report, but it still counted as points for me for Diplomats paper. That was on epithelial basement membrane dystrophy. And then for the cases, I think the two I sent across, one was on GP fitting for high myopia. The other was on center distance multifocal contact lens. And the other case was on management of severe ocular allergy, VKC actually, with shield ulcer. And then there was the written exam. I think there's one other case I'm not remembering because there were 7 in total. But I mean, those parts were fine. The written exam I had to take twice. I took the second one in March this year and I passed that. The orals, I mean, I can to a good extent defend what I've written down and to the best of my knowledge, the literature surrounding that. The only part I'm worried about mostly is the practical exam because it's going to be with real life patients. And from the breakdown that was sent in the email, there'll be 8 patients, 15 minutes per patient, with specific kind of corneal conditions. So I'm worried about what if I forget something? What if there's something I'm thinking I should say and then I don't say? Yeah, because at this point it's not someone who's asking me something and then I'm responding. It's me examining on slit lamp, topography, explaining what I'm seeing, describing what I'm seeing, diagnosing a condition, talking about management. So that's the part that worries me more, the practical part of things.
Okay. Yeah, thanks for being that honest and open about how you feel. And I know Professor Chibu has had few questions prepared, which I think in the process of that, it's not more like an exam. It's more like telling us what you expected to respond to questions like that. So it may not come out the way he's written it or the way, but something similar may prop up in your exam to which then we can offer a few ideas on how you could approach that. So if you want to go, Professor Chibu, that's awesome. Let's see what those questions look like.
Thank you very much, Dr. Oswaldo. I want to actually circle back to his main concern, which is the practical exam. I'd like to know what kind of cases are you going to be presented during this exam?
So the conditions that were sent in the email, keratoconus, pellucid marginal corneal degeneration, at least one corneal dystrophy, patients with the following lenses: hybrid contact lenses, corneal GP, which may or may not be spherical or bitoric, hybrid scleral piggyback. I think there was also myopia management in there as well.
Okay. Now, I'm going to ask you a question about EBMD. let's say you have a patient that has EBMD during the practical exam.
Mhm.
This is what happens. Okay, you have the examiner in the room with you. You see the patient. After seeing the patient, they're going to ask the patient to either leave the room or stay in the room, and they're going to ask a question to actually assess if you understand what you're doing in terms of management. So, for instance, just have a young patient, or maybe a 50-year-old patient has EBMD, and you do your exam, it looks great, and you're happy with your diagnosis and your assessment and plan. They may ask you, if a patient has diabetes and presents with this kind of condition, what's the underlying disease process? What are you going to say?
Okay, so what's the underlying disease process if a patient with diabetes presents with EBMD?
Yes.
Okay. First would be the due to non-enzymic glycation in diabetics, there's poor wound healing. And due to the poor wound healing, you may not have the corneal epithelium regenerating properly with the hemidesmosomes, allowing it to attach to the epithelial basement membrane. So due to that poor or delayed healing, that could lead to the doubling of the lamellae that you see within the epithelium, and that will lead to the curvilinear patterns of the map dot patterns. Also, recurrent corneal erosions may occur. Dry eye disease also due to increased osmolarity.
Okay, stop there. You see, there's a little bit of mistake. So when they ask you a question, focus on the diagnosis. Don't go into something else. When you do that, you open the door for them to ask more questions about dry eye disease.
No.
You see that?
Okay.
So
Yeah.
if they ask you A, stay on A. Now, you talk about so if I were you, I started by saying that the normal epithelial adhesion complex has this and this, and the corneal basement membrane has laminin, fibronectin, collagen type 4 and type 7. In diabetics, we're going to have a case of an increased level of fibrinogen in the blood. So the possibility that it's going to be an increase in the amount of fibronectin causing an uneven, corneal epithelium, which can be manifested by doing a sodium fluorescence staining, in which you're going to see some what? What are you going to see? Positive staining or negative staining?
It's going to be negative staining.
Excellent. So you see, keep it simple. The problem we have is that sometimes candidates try to show off their knowledge and go so deep, and then what happens? You open the door for more questions.
More questions.
Okay, so you're going to keep it. So your answer before was great, but start from the basic and build up little by little. As you're building up, keep your eyes on the examiner. Look at the expressions as you're going. So your response looks great, but don't move from the diabetic portion to this stuff.
Something else.
And they may ask you about which diabetic, biochemical pathway is actually involved in RCE. You have to know about the different pathways, the sorbitol pathway. You have to know about, the AGE pathway. You have to know about all these pathways. You can say, so these are things you need to focus on. So there are a lot of diabetic patients we have in clinic, and that is a possible question they may ask you if you have a patient that has EBMD. Okay? But please don't give the examiner any room for them to move you and take you down a rabbit hole into dry eyes and other stuff. No, you're not there to show off your knowledge. You're there to answer the questions that they ask you and wait. Okay? All right.
Yeah, thanks, Prof. Thanks for that very, very in-depth stuff for me too. I got chills when you were saying that, because the depth of that information is huge, and I think it all shows that expert knowledge we're talking about. I work in diabetes, and that's really where it really made sense when you're discussing that with Obi-Wan. And I know Edgar has been pausing. He said, Edgar, do you have anything else to add to that? Just before you go on, we've noticed Dr. Yvonne came online. So Yvonne, do you want to just say hi to the group, just so when I say Yvonne is one of the candidates as well who started this process and is still on that journey. So quickly tell us, where are you at in your diplomat journey, so we know where this advice will really suit you. Oh, I think her network is off. Okay,
I'm sorry.
go on. Okay, so she will join back later.
I'm sorry. I have another question for Dr. Obi-Wan that I didn't get a chance to ask.
Oh,
So,
sorry, Prof. Yeah, go on.
okay. So he mentioned the phrase or acronym MMP. They may ask you which MMP is involved in the corneal wound healing process. Which MMP is going to be causing problems with the normal corneal wound healing process? What do you know about the TIMP, its involvement in the healing process? So when you talk about dry eyes, you're taking them into more MMP activity and TIMP. So you have to be careful.
Mm-hmm.
Okay. All right. I yield back to the chair.
Thanks, Prof. And do you want to go, Edgar? Any word of advice?
Yeah, simple questions that you should prepare for. Why myopia management? Why did you pick that topic?
Okay. I picked myopia management because it's part of my specialty. And also
What piqued your interest in the area in myopia management?
okay. Because I don't see a lot of patients being managed according to standard of care or using evidence-based management practices in the area or the state or the country where I practice in terms of myopia. And I felt a personal responsibility to better myself in that area of optometry, to offer that service to individuals, especially children who I see day in, day out with progressive myopia and the complications that is associated with it, and nothing is done for them.
That's good. I'll prefer the complications of myopia first.
Okay.
Before but that's good. You got to the same point at the end of the day. In your case, so there's a question that just yes, you gave your patient two options, right? The mom, the option of an ortho-K or of a multifocal center distance option for correction of myopia. What if the mom told you money is not the option, and she wants to know what your judgment is? What will you advise them to? Which of those options will you advise them to pick?
Because of the efficacy, I would have gone with orthokeratology compared to a center distance multifocal contact lens, if cost was not an issue.
Yeah. What's the efficacy difference quantitatively?
Yeah. The literature for orthokeratology reports between 55% to about, depends on the clinical trial we're looking at, but up to about 80%. But I think 80% is sort of a stretch. But yeah, the literature reports between that range. For center distance multifocals, it ranges from about 42% to about 60%, especially from the recent Blink 2 study that compared low ad versus high ad. So, but looking at the efficacy in terms of customization, especially with orthokeratology, and I would have gone with that option.
Okay. And my initial question about why you used tropicamide instead of cyclopentolate or other options.
So you already mentioned the first reason. It's what's available. We hardly are able to find cyclopentolate in Nigeria. But this another reason is the reversibility. Cyclopentolate, yes, it gives quick action, but the effect tends to last sometimes up to 24 hours in some patients. Meanwhile, tropicamide, the reversibility typically 6 hours, 7 hours. It's reversed.
Will you
But
expect
the main reason?
Yes. Will you expect more action for with cyclopentolate for an individual with darkly pigmented eye, right, like your patient, compared to white population?
Yes.
Most of those studies for cyclopentolate
Yeah.
got acting for white people, right? So will you have expected
Yes, exactly.
such long-lasting action with cyclopentolate therapy?
I would expect a more rapid action for my patient because of the dark iris pigmentation. And in terms of reversibility, I think it will be faster in a dark pigmented iris.
Yeah, I don't know if Prof has further questions.
Yes, Dr. Kure, thank you for letting me into this question. Dr. Obiwanne, let me be very honest with you here. Also, your clinical thought process and also the common sense approach here would have been that cyclopentolate is available to me in Nigeria. That is sufficient enough to calm the nerve. But when you said to me about tropicamide is going to use cyclopentolate, it gets, dilated for blood for a long time. They may ask you, why don't you bring him back on a Friday and do the exam on a Friday? Saturday is no school. What are you going to say? Yeah. So.
Yeah, now I get that.
Sorry?
I said I get that now.
Yeah. So please, whatever you answer will open the door for them to criticize your style of practice. So common sense will say to you, oh, you know what? I'm going to use cyclopentolate on the weekend because on a Friday, because Saturday is no school for the patient. Or I use tropicamide because cyclopentolate is not available. And according to Dr. Kure, and also according to preferred practice guidelines, cyclopentolate is the standard for doing cycloplegic refraction. So I will stick to the answer of tropicamide was the only thing available for me in Nigeria. I had no access to getting cyclopentolate in a timely fashion. That's what you should say.
Yeah,
so
thanks.
Also about responses. Your response is important.
Yeah, thanks, Prof. And I think it just boils down to that, sticking to what you're sure of. Just a follow-up question may then be something you don't know where it's going to come from, but giving that room for those questions that will throw you off balance is something that we try to protect. So Yvonne is back. So Yvonne, if your network is a bit stable now, you want to quickly tell us, first of all, introduce yourself. You joined us a bit late, and I appreciate that you did inform us early on. Introduce yourself and where are you in your journey towards this diplomate state?
Okay, my name is Yvonne Megbele. I practice in Nigeria. Actually became a diplomate, I think 2 years ago. We did ours online because of the COVID stuff then, at that time. I actually became a fellow because of the diplomate program. I'm actually into occupational vision, and I've been on it for quite some time. I was actually looking for a place to get more knowledge on it because most of the work I've done has been self-effort. After I did a master's in occupational health in the University of Birmingham. So I saw the diplomate program in the African Academy, and I decided to go through the process. So the first process was becoming a fellow, which I did. And thereafter, I launched into the diplomate program. For those of us in public health and environmental vision, it's a different ballgame altogether. You start by applying to the session, and you have to write some essays on why you want to become a diplomat and all that. And they go through your application. Thereafter, a panel meets on your case, and it is decided whether they'll get you into the program or not. Finally, I got into the program, and the next stage was for me to write an exam. I tried to do that, I think, the year before, but I wasn't successful. Well, like about 5 or 6 of us wrote the exams, but only 2 people were successful at that time. But they said we could repeat it again the next year. So the next year, I also took the exam, and to God be the glory, I was successful. I think I was the only candidate last year that was successful. So the next stage after that is your project. Whenever you finish your project and is approved, you do the orals at that particular time in the academy, and thereafter, you're conferred with the title of a diplomat. But the project is something you can do. You have about 3 years to complete it, depending on your speed. I actually wanted to do mine in 1 year, but the supervisor I had was not forthcoming. I don't know why the delay. Probably it's a way they do it. I don't really know, but I noticed that she wasn't forthcoming. In fact, she actually told me that, look, you don't have to be in a hurry. That if I write the project and they don't accept it, I will have to write it again. But I have to really complete the process. So she was going to get back to the supervisor, that's a mentor, somebody that could, put me through and guide me along the process. But she never got back. But so I'm still in the process of writing my project. And I was actually distracted a bit, so I couldn't meet up. Actually, I was supposed to have submitted that project if I wanted to be conferred with the diplomat title this in Indy. I was supposed to have finished with it, say, by July. They were supposed to go through, approve, then I do the oral exam in Indy, and if I'm successful, I become a diplomat. So I'm hoping that next year, I'll be able to finish the project on time, submit, and finish up the process next year.
Yeah.
So basically in the PhEV, that's how it works.
Yeah. Look, thanks, Yvonne. That's really good. So what is the project about? Is it something you're open to? What are you working on?
Okay. Like after the exams, I actually had an oral interview with them after the exams. So they were like, it was a panel. I had to face a panel. That was last year at the academy. They asked some questions about my work and all that. And they also asked what I would like to write about. They actually proposed I work on occupational injuries in Africa, something that had to do with occupational injuries. They wanted to know more about the African experience. Most of Okay, sorry, I went off. They actually wanted to know more about the practice of occupational health in Nigeria, what we do, how the laws are, and all that. So we talked a bit about it, and they wanted to know more. So they actually asked me they would appreciate it if I go into occupational injuries. They wanted to know about the Nigerian story, how we practice, what laws we have, and all that. So basically, that's what they want me to do. Work on occupational injuries. So you have an option of you send in 3 topics to them, a proposal of 3 topics, and they choose one out of the 3. So I sent in 3 topics. I sent in something on compliance and occupational injury and 2 other topics, but they chose compliance. So basically that's what I'm working on.
Yeah,
so it's either a position paper, you do a position paper, or you do a research and all that.
Yeah, thanks for sharing that with us. I'm not sure if the panel, Professor Chibu and Edgar, any word of advice for Yvonne's case is quite different from Obi-Wan's style of examination as well.
Yes, I will say to you, congratulations for getting so far in the process. I know it's like you're in a hurry to get this done, but don't forget one thing is a process. You have to actually go through the process so you learn from the process. And do you have a mentor?
I haven't gotten one yet. She said she was going to get me one, but she hasn't. So I'm hoping that in Indy, I'll be able to get one.
So I'd like
We
to know,
usually have sessions, so I
when
hope
did you start when did you start the process? When did you start this process? When?
the diplomate process,
Yes.
I
Which
think the
year?
year before. The year before. This is 2024, right? I think 2022.
Okay, so normally, because I'm a member of I used to be the chair of the comprehensive eye care section. Once you become a
Okay.
candidate, we always assign you a mentor within the first 6 months. That's the process. So I don't know
Okay.
why there's a delay in assigning you a mentor.
Okay. I'm wondering as well.
So you need to actually, reach out
Although
to
we have there's somebody that chairs the diplomats committee.
yeah. So reach out to them. That's what you need to do. So
She
reach
is
out.
actually the person I was reaching out to. She was actually the person in contact with me.
Yes.
But she said she's into public health. Most of them are into public health. There are very few of them, in environmental vision. So she said she was going to get somebody to mentor me, somebody in occupational vision, and also probably maybe somebody that had an idea about what I'm doing. But she never got back to me. So that's where we are.
Okay. Okay. I would say to you, try and reach out to the chair of the diplomat of your public health, and try to tell her that please, I need a mentor, because without a mentor, you're gonna actually end up slowing down the process for you. You have about
Okay.
5 years to complete it. Is that right? 5 years to complete it.
Yes, 5 years to complete the whole process.
So that means you have to get it done by 2027. Is that right?
Yes.
Or 26?
2027. 5 years from 2022
Okay.
to
All right.
2027.
Yeah. So if I were you, while you're waiting for a mentor to be assigned to you, continue to write and get your stuff ready so that when they say is your mentor, they can actually, speed up the process for yourself. Okay. So I wish
Okay.
you all the best.
Prof,
Thank you.
can anybody be a mentor? I mean, anybody with a PhD, is there a particular criteria? Do you have to be a diplomat to mentor somebody going to a diplomat? What's that? Do you know what that process is?
For the comp eye care section, we have diplomats that are going to be assigned mentees. So I think that for her, she has to have a mentor who's a diplomat in public health to be her mentor. That's what she needs. And that is the job of the chair of the diplomats, to actually get one, assigned to her. So, but if I were you, I would actually find a way to reach out to anybody that has a diplomat in public health, try to get to know them and get them to give you some advice on how to proceed.
Okay.
So you have to think outside the box in this one.
Yeah. Prophet
Okay.
Chibu, do you have any suggestions? Do you know anyone close
Yeah,
person? I mean,
actually, you know what? So I have a friend. She is a diplomat in public health, and if you want to, I can, talk to her
yeah.
and see if she can do me a favor and, work with you. Okay.
Okay. Is she
So
into occupational health or
yeah, she has
public health?
a diplomat in public health. I don't know her area, but I need to ask her.
Okay.
So,
Okay.
Yeah, that
so
that
just
that'd be useful.
shoot me an
Okay.
email, and I will actually talk to her. I will just reach out to her and see if she can
Okay.
be assistance to you.
Okay. All right.
But
Thank you so
Right
much.
direction.
yeah, I think that's very useful. I know there'll be very few diplomates, for each section. So finding one will be tough job
Yeah.
for
It's
somebody who
done
doesn't,
especially for occupational health,
yeah, somebody who doesn't
although
know
there are
who they
few
are.
of them. Mm.
Yeah, so that would be very useful. And look, if there's anything the African chapter could do to support that, please do let me know. We can actually back up those emails to say, look, this is quite a long time now, and that's slowing down your process. They would act a little bit further. But let's try Dr. Chibu's Professor Chibu's plan. That should work. If not, we can really go. Because I met you 2 years ago and you told me you want to start this process. So it's
Yeah.
really good to see that you actually took that on board and gone towards this close to that end, which is really awesome. So Egg, I'm not sure if you have any sort of advice for Yvonne or something else to add to that.
Nothing profound. It's not my area, so there's little advice I will give to her. The only thing I wanted to be mindful of is to follow process, especially if you're doing your project. There will be guidelines for what they expect a public health project should be like. I don't know what that is. I think Professor Chibu's suggestion that to link you up with someone who can really guide you. You don't want to do something and you get there and that's not what they expect.
Yeah.
Okay.
Yeah.
So that would be my only advice for you. You have to get a mentor. Okay. Don't do this in
Alone.
isolation
Yeah.
at all. Yeah, that's it.
Thanks, Edgar. Look, we're sort of rounding up now, but I want
Thank
the
you.
candidates to kind of speak too. So, Obiwanne and Yvonne, I'll go with Obiwanne first. Do you have any questions that you think this panel could suggest responses or kind of support in your thinking process for this?
Dr. Swabuk, I need
Yeah.
to ask Dr. Obi one more question or two questions before he goes.
Okay.
On the case of the 8-year-old patient, I'd like to know, did you flip her upper lids during the first exam?
Yes, I did.
Okay. And she developed GPC during it at the second visit or the third visit or the fourth visit?
I think this was on the third visit, after she had started wearing the contact lenses.
Okay. So in your own clinical opinion, what caused the GPC in this case? Because according to you, there were no deposits on the contact lenses. It was as clean as possible. So what caused the GPC in this case?
Okay, so it might have been the contact lens itself, the presence of maybe the conjunctiva seeing it as a foreign body. Might have also been due to overwear, because at the visit where the GPC was diagnosed, she was wearing, I think, about 16 to 18 hours daily. So probably due to overwear, and it's possible those deposit buildup was not happening at the time when I was evaluating the patient, but possibly towards the end of the day, that may have been occurring as well. And also the last possibility may be the season or the period when this patient was started wearing the contact lens, because this was during the end of the year and close to the Harmattan period, where we'd expect it to be dusty and allergic issues coming up.
Okay, so does she have any history of allergies?
After the diagnosis was made and we probed further, yes, she had the previous history of itchy eyes, but these tended to be seasonal allergies.
Okay, so if she has seasonal allergies, what would be the most appropriate way of actually treating this case?
First would be environmental modification, encouraging probably protective eye, excuse me, protective eyewear, Also, reducing for seasonal allergies would be reducing exposure to the known irritants or things that we know that could trigger the allergy, and then putting the patient on probably a mast cell stabilizer to prevent to take care of the itchy sensation and prevent further degranulation of mast cells.
Okay, so in your own clinical opinion, do you think that giving her a sodium cromolyn would be the best option, or would have gone for a dual acting agent such as Pataday or Lastacare would have been better?
Yeah, I agree with. I think given something that would have been dose friendly, something like olopatadine, Pataday, like you mentioned, may have been better because it's dosed. Sorry.
Go ahead. Yes, please go ahead.
Yeah, because it's dosed twice a day.
Excellent.
So that would have been more friendly for her to instill in the eye. However, Pataday is very, very difficult to get where I practice.
Okay, so don't forget, they might ask these kind of questions that you're using cromolyn 4 times a day for a 8-year-old who's in school. You're gonna say that because the Pataday is not available in your locality, which could be used twice a day. So I don't want to know if you're using cromolyn 4 times a day because of availability. They want to know your clinical thought process. If you had option or availabilities, what would you do? You said the right thing, which is I would have used what? Pataday, 1 drop a day, or Lastacare, 1 drop a day, or ketotifen, 1 drop in the morning and 1 at night time. That's excellent. That's excellent. So I'd like to know, last question for you is this. This is an 8-year-old patient. How would you tell the mom to make sure she cares for the contact lens? And why is exposure to water a problem here for this patient?
Okay, so the first reason why exposure to water with contact lenses will be an issue is because of acanthamoeba. We know that it could bind to the contact lens and cause acanthamoeba keratitis, which may be elusive to diagnose initially, and when it's finally diagnosed, could cause significant corneal damage. In terms of...
Hold on. Hey, Dr. Biwane, you give your answer, make it short and sweet, and wait.
Okay.
The more you talk, the more you give the examiner more options to ask you questions. So I can't remember one. What's another one? Bacteria. Give me a bacteria that can cause a problem for somebody that has exposed their contact lens to water. Give me one for a parasite. Give me one for bacteria. Pseudomonas. Sir.
Okay.
And then they're going to ask you, in your part of Nigeria, do you have a lot of rainfall? If the answer is yes, they may ask you which fungus is likely to be a problem when you expose the contact lens to water. And you should give an answer, Microsporidium species.
Yeah, Microsporidium.
Okay, so, and they may ask you, how would Microsporidium, Casey present in a patient? You see? So, we're trying to understand if you know the risks and how to actually diagnose these conditions. So keep your answer short and sweet and to the point. Okay? All right. All right. I yield back to the chair. I'm sorry to take your time.
No, thanks, Prof. That's really good. These sessions are not easy to come by, so I do appreciate your time. I'm also cautious that everybody has got activities to do as well. So Obiwani and Yvonne, does anyone have any question for the panel or things you kind of feel you need response to? So anyone can go if you're comfortable with that.
For me, I don't have any questions. I think they've basically answered. I had questions surrounding how the practical exam was going to go and what it was going to be like and what's expected during the orals. I think both Edgar and Professor Chibrod answered that. So thank you very much.
Yeah. Okay. And Yvonne, any questions from your side? I know you're not there yet, but
Okay.
you will be soon.
Yes, nothing much is I'll reach out to Prof to get the okay. Prof said I will reach out to him concerning the mentor. I think I need one
Have you got
to guide me.
Prof's email?
No, I don't have it.
Yeah, Prof, do you mind kind of popping it here? Thank you. That's awesome. But you have so many emails. I don't have this one. This is a new one. The one I have is different. Have you moved platform?
Yes, we have actually moved over to Drexel University. So
Okay.
I have a D. Salis University email, and I have an email for Drexel University. So,
Okay.
so this is my new email going forward.
Okay. So the other one, does it still work, or we'll just delete that one?
You can delete it for now.
Okay. Awesome. Thanks for that. So Yvonne, first I popped his email here, so you can email him directly, and he will provide you that contact
Okay.
that you need. That's awesome. And if you're comfortable, just keep me in the loop with those emails so I know where we
I
lose
will.
things and I can push forward. Prof is quite busy, and I know you are too. So I can make sure that those things align when we need to. Yeah.
Okay.
But look, besides that, go on, Edgar.
Yeah, just want to thank both of them. Obin, I think you're solid with your at least the theoretical aspect of your cases. Just be confident, like Prof said. Go to that practical, relax as much as you can, sleep well. Okay. If you pray, if you meditate, just calm yourself, do your best. You strike me like somebody that's been in practice and doing these things in your office, in your private practice. If that's the case, just replicate that. That's all you need. You seem prepared to me. I've interacted with a lot of people going for fellowship and stuff like this. I think your preparedness strike me as one of the best I've seen so far. So congratulations to both of you. Just keep the spirit, and we'll celebrate with you, okay, at Indiana.
Yeah, and thank you. Yeah, go on, Obi. I saw you on mute.
Yeah,
I'm not
so,
just saying.
Dr. Obiwanne, I'm very proud of you. I respect you. You have great clinical knowledge and you have great clinical insight. But don't let your superb clinical knowledge be a handicap for you. Keep your answers short, and don't try to go into long tirades of answer, because that would mean you're going to create more opportunities for them to ask you 20 questions that you get, frazzled. So, just go there, do the job, execute, and come home with a trophy. And join me. Please join me.
Look, this is a special moment for us, and I know because we only have one diplomate in the African group. So to get a second person is a climax of what we are looking for, and that will inspire other people. Yvonne is in the process. Ayuko is, unfortunately, he's not here. He did say he was going to attend. So I think this is really an impactful section for me. It also means that we can encourage younger people to think further beyond the fellowship. That's what we try to do. What next levels can you get to in career, your career progress? And it just helps us to be better people overall, attitude, behavior, like everything changes because this knowledge transfers to our skill sets, to our thought process too. So thank you guys for making time to be here. It's really a good session. And I do wish Obi-Wan the best of luck when you get in there. And please take time to meet some of us. I know you'll be very busy with preparing and all the things you're involved in. we'll always catch up. So I want to make sure that we can celebrate with you. If we know where the section is going to take place, I will be there, unless I have something else going on. So let us know what time, what place. I know I met Edgar one of those days when he was trying to get into the hall to say something about his project. And we took a picture with the wife. That was the first day we met, the first time we met physically. So it was really good to see that we are taking that process. So let me know where it is. I can put it on a platform, anybody who's free to attend and cheer you up and be there and kind of support you as well. Because I know that process, you'll be the only one of African descent there. That I can assure you. So we need people of similar mindset kind of being around you and making you feel more safe and comfortable. So thank you for taking time to be there. And for Yvonne, all the best, and make sure we can support you where we are able to. And sorry, I'll need to edit essential, Joe. We are now an hour 17 minutes on, although we started quite a bit late. But thank you, Professor Chibu. Thank you, Edgar. These guys are super busy. To be here and be able to stay this long is I cherish that a lot. It's a gold for me because you don't get them elsewhere. So thanks for all your time and all you do for us. And I wish you guys the best of luck. See you at Indy, and we'll celebrate party as well as usual. All right, all the best. Safe travels to those who are moving. I'm leaving tomorrow. But when he just called, he's leaving tomorrow as well. So on Tuesday in the US time, we'll all be there. So hopefully we'll have time to socialize as well. Professor Chibu, when are you coming? You haven't told me. Yeah, Professor Chibu, when are you arriving in Indy?
Okay, I'm going to arrive on Wednesday afternoon. I'm only there for one lecture. That's going to be the Comp IK section symposium in the morning. After that, I'm free. So I will arrive on Wednesday and I leave on Friday morning.
Yeah, please buzz my phone when you're there. The WhatsApp will still be working. And we need to catch up with the other prof too, who came on board, and she wants us to meet somewhere. So
Okay.
if you can arrange that and let me know, I will make myself available at those periods and we can have a catch up as well.
Yeah. So
That's
to Dr. Obi-Wan, feel free to call me anytime you want. If you call me, I will answer your phone. Okay. I want you to succeed because your success is also my success. To Dr. Yvonne, I will do my best to get Dr. Greenspan, my friend, to actually provide you some assistance with getting a mentor. Okay.
awesome. All right, thanks. Thank
Thank
you,
you.
everyone. Nice. All right, take care. All the best. See you guys.
All right.
Bye. Yep.